in, everyone. We're just starting the recording, and we just wait a minute or so to let everyone get on or into the meeting. Thanks very much for joining. If you've been to one of our webinars before, you know that what I'm going to say is we'd love you to go into the chat and say where you are, who you are, why you're here. So my name's Elizabeth Deveny. My pronouns are she, her. Love you to put your pronouns in the chat so we know how to address you. Where are you? I'm in Naarm, on the land of the Wurundjeri people of the East Kulin Nation. Again, love to know where you are. If you're representing an organisation today, give us a shout out, especially if you're one of our member organisations. Love to see our member organisations here. Perhaps you're here as a concerned citizen. Fantastic. Let us know that too. We'll just wait another probably 30 seconds or so, let the last few people in, and then we'll start. So I think there's about 40 of us at the moment. Love you to all get in the chat if you're not there already, and start putting in hi, my name, here I am, looking forward to the session. I'm here. Where are you? Anyone in Ghana country? Anyone from Meejin? Anyone in Larrakia country? I don't know. Let us know where you are, where you're from. Fantastic. Thanks. Welcome, Brendan. Welcome, Tess. Welcome, Mark. Welcome, Peter. Okay, so feel free to keep adding things into the chat there, folks, while I get us started. I'd like to begin by welcoming you all here to our budget analysis webinar. And in doing that, I'd also like to acknowledge, as many of you are on the chat, that we're all on Aboriginal land, Aboriginal Torres Strait Islander land, and I wish to acknowledge the traditional owners and custodians of the land, wherever we are around the country. Someone from Ghana country too, fantastic. Welcome, Leanne. Welcome, Mark. I'd also like to acknowledge and welcome any Aboriginal or Torres Strait Islander people who are here with us today on the call, and encourage those who are just arriving now to pop into the chat and say hello. You'll see what people are doing. They're telling us where they're from, as in what organisation, and also where they are in the country, sharing their pronouns. So if they ask a question, we know how to respectfully respond to them. I'd also like to acknowledge lived experience, and we have a recognition of lived experience statement developed with our Consumer Assembly, and you can see that on your screen right now. I'll give you a little moment to just have a read through, and often people will find that one part of that statement particularly resonates with them. Today, I'm really thinking about the kind of a human rights perspective, I suppose, on consumer engagement and this notion that we recognise the right of every person to equitable access to healthcare, regardless of their background or circumstances, and thinking about what this latest budget means when we think of healthcare as a human right. Now, you will find down the bottom of your screen somewhere, whether you're using your phone or your laptop, a little react button. And if you go in there, there are a whole lot of reactions you can use. So just as I run through what we're doing today, love you to just test those out, try whichever ones there are. And during the session, as people are talking, really encourage you to use those as well as the chat to share your thoughts. So in a moment, we're going to show you a video with some health consumers talking about what they're hoping to see in the budget. Then we'll talk about what we asked for, what the sector's saying, what's in it for health really. And then Tom and I will have a bit of a chat about the budget and where to from here. So there'll be an opportunity to share thoughts and ask questions all the way along. If you've got questions, pop them in as early as you can. We'll try to cover off as many as we can during the session. But first, let's hear what our health consumers said when we asked them, what do they want the minister to know?
We're the ones using these systems every day. So why shouldn't we be included from the outset?
Listen to those that have lived experience. They know what the community wants. They know what will best benefit their community as well.
If they provide a service appropriately and very timely, because the people are waiting, especially the kids, if they have ADHD and they have autism, they are waiting too long. Sometimes they get the service when it's too late for them. So it should be more service or more centers should be provided by the government to the community.
It has not always been this way, and it does not always have to be this way. And listening to people who are here first and the access that we have, that's what we need to be doing. Listening to people on the ground, in community.
So we've had Aishwarya who died, we've had Shandipan who died, we have Monica Mann who died. All of those cases could have been, had much better outcomes. I'd like to see that concept of a patient advocate developed right across the board, not just in CALD, not just in Aboriginal communities. It has to be right across our health system. We need to have that.
Invest more into prevention, because healthier people, lower cost.
Chronically ill young people are actually quite an overlooked population, existing somewhere in between. They're often isolated, often lonely, and struggling to be seen and heard. Investing into adolescents and young adults is an investment into our nation's future.
Clinical experience is vital, right? But lived experience also has to be a really important part of that picture. It needs to be done with consumers, not for consumers.
They need to ground themselves. They need to come back to being, I always say to the doctors and who I'm doing meetings, I always say, remember, you are me. You are a consumer. Just because you sit there and think you're a god, you're not. You're a consumer like me. And when you get to this side of the screen and you are a consumer, then you will understand what I'm saying, the service I expect you to give me.
Nothing about us without us is a fundamental advocacy principle, and one that I wish was more deeply embedded into this particular aspect of societal function.
Yeah, thanks. Show your love. Did you enjoy that from consumers? You can use your reactions. You can pop something into the chat too if you like. Really great members of our Consumer Assembly, great wisdom that they've shared. So now we're going to do a bit of a poll and ask you, do you think there was enough investment, new investment in health in this budget? So it should be up on your screen now. You can choose one button. Just give you a moment. And then I'll pass across to my colleague, Tom. Thanks, Tom.
Thank you, everyone, for voting. So, yeah, it's pretty definitive. 73% of you have said not really, and somewhat enough. So, yeah, it's pretty powerful response from everybody in the audience. So, we were at the AIPS budget breakfast earlier today, which brings together a broad cross-section of not-for-profits, industry, consumer groups, sector, government representatives, and of course, consumer organisations. And we heard directly from Minister Butler about what his views of the budget are and his forward plan. He acknowledged the strong engagement across the health and care sector, including parliamentarians and everybody in the room. He highlighted the government's ongoing commitment to closing the outcomes gap for First Nations and non-Indigenous Australians, noting this remains a key priority of himself and his government. The Minister also recognised the work of the department and its leadership in managing current pressures across health and aged care. just briefly, some key points that he reinforced. Ongoing engagement with stakeholders as budget measures and reforms progress. A 5-year hospital agreement. 500 million investment into states to support First Nations health initiatives, and continued focus on resetting the NDIS to ensure long-term sustainability and engagement with aged care providers, and addressing the affordability and access challenges in private health, particularly related to specialist fees. He then looked forward and signalled that he was firstly going to introduce the legislation for the first phase of the NDIS, commencement of discussions on health technology assessment review, continued strengthening of mental health services, and further investment in Medicare, including the permanent establishment of urgent care clinics as an ongoing feature of Australia's healthcare system. The Minister's message centred on sustainability and ongoing reform, particularly in areas where pressure on the system was becoming increasingly visible to consumers. So we were lucky. Elizabeth actually had a chance to ask the Minister a question, and the next video will go to the next slide, and we'll hopefully the audio will play and we'll be able to hear the question. And I'll apologise ahead that people were eating, so I'm sorry for the sound in the background. But here we go.
Good morning, Minister. Elizabeth Deveny, CEO of Consumers Health Forum of Australia. First of all, congratulations on your budget. We have some congratulations too, because it's our 40-year anniversary, having been first funded 40 years ago by Dr. Neil Blewett. I'm interested to know what your vision is for the next 40 years and how the consumer movement will be engaged in reforms that you intend to implement.
Well, thanks, Elizabeth. Congratulations on reaching middle age. Get much of it, not personally, but your organisation. As you know, I hope I'm really passionate about the patient voice, the consumer voice in this whole portfolio. We do it terrifically well in some parts of this sector. Very well established arrangements, as you would expect in the NDIS, given that scheme was built on a philosophy of nothing about us without us. In health, there are some parts of the sector that are gold standard. There are others that, frankly, have been behind the 8 ball. You know, I've talked about how passionate I was about establishing those peak consumer groups for mental health. They were not there for a decade, but they're now back, and they're at the table in every discussion we have around mental health policy, as they should be. So we've got a bit of a contrast really. When you look at the international evidence, the patient voice in Australia is consistently ranked at the top of the world in terms of its level of organisation and its ability to impact government and policy decisions. But also there are gaps. And so we rely very heavily on CHF as the peak, as the ACTU, if you like, of the Business Council, of patient voice, to help us identify those gaps, build that capability, build those skills of the patient reps. There's many in this room who do that as well. Industry leads in to help provide resources for patient voice as well. So it's a shared commitment we all have. We should celebrate the degree of success we've had over the 40 years of CHF and many other patient organisations that are in this room, but not rest on those laurels and recognise that over the next 40 years we can do even better.
Thanks, Tom. So what did CHF ask for? Every year we put in a submission to Treasury early in the year. And that submission is developed through talking to our members and others and saying, what do you really want? So the three things people said they were really keen on, first is to fund this national consumer engagement strategy that the government has developed. So it's great to have a strategy, but if it's got no money to be implemented, it's of little value. So we said you've got to really fund an implementation and make sure every piece of work that the health department does, that the statutory authorities do, like the Commission on Quality and Safety in Healthcare or the TGA or the Australian Digital Health Agency, really has strong consumer engagement. One of the things we hear clearly from everyone is that oral health is really challenging and that dental care is out of reach. And so we said we really want to see that improved, and we said let's start with some groups we know are perhaps having the most difficulty, such as older people, First Nations people, and people on low incomes. And the final thing we said is that the Medicare offers a lot of opportunities, and indeed even outside Medicare there are opportunities to get better access to care, to get cheaper care, more affordable care, but a lot of people just don't know about it. So we really need a community education campaign so that everyone here knows exactly what they're entitled to get. So that's what we asked for. Then what did we actually get? So what was in the budget? So I get to do this really weird thing called the budget lockup. So a few hours before the budget's announced, you go to Parliament House, and with a couple of hundred people, you're locked in some rooms and you can't leave them. And they give you a copy of the budget papers before everyone else, before the Treasurer has started his speech, and you have a few hours to pore through it. One of the things I noticed really quickly when I was looking through that lockup set of papers was that much of the health story was actually sitting outside the traditional health portfolio. So, for example, trying to make housing cheaper, or helping people who have got skills from other countries have them recognised in Australia so they can work in their chosen professions. Even things like reducing the excess on fuel for the next couple of months. Those things can all make a difference to your health, but they're really outside of the health budget. And the other thing as I read through to see what was in the budget that was going through my mind was what assumptions about people's lives do governments make when they make these budget decisions? So there are four areas here you can see on this slide. Strengthening Medicare, which you'll be familiar with because this has been a theme for the last couple of years. So more money for things like bulk billing incentives and so on. Cheaper medicines. For many people, medicines are a critical part of their daily lives. Without them, their health and well-being is significantly impacted. More money going into research, which hopefully will help people who have experiences where there's not a lot of evidence about how to make you feel better. And the public hospitals agreement with the states and territories, which was actually announced earlier this year but appears in the budget today. So these are the four main areas. So let's talk about them in a little more detail and really what the highlights and the lowlights are. Thanks. I'll look at the next one. So urgent care centres. I'd love you if you've got a thumbs up or a thumbs down if you've used an urgent care centre. Who's used one? I have used one. I did not have a good experience. I'm hoping someone else did. Please tell me you had a good experience. You did. Fantastic. 2 people had a good experience. Yay, that's great. I feel better now. Maybe my bad experience is not the same as yours. So there's a lot of money going to this, nearly $2 billion. And the government's saying these are really permanent now. So for those people who have an urgent care centre, it might help them. But these are particularly in metropolitan areas. It really does less to address persistent affordability and workforce issues in regional and remote Australia. Dental. So this is good. Having this dental benefit schedule open to state and territory services, which is great. That's $1,200 over 2 years per child, and it's accessible to you generally if you get family tax benefit A. But only 1 in 2 families ever use it because many people don't know this benefit exists. So we're hoping that this will really help kids get care that they need in state services, because we're hoping the state services will promote this, and that'll be great. Next slide, thanks. The public hospital funding, which some of you will be aware of because that was announced earlier this year. This is much needed additional money going into hospitals as part of the National Health Reform Agreement. And cheaper medicines, which I mentioned earlier also. So the budget includes a range of new PBS medicines, particularly for cancer, chronic illness, some neurological conditions, and so on, COVID antivirals, and the RSV vaccination for older people. So if you happen to be someone who these drugs are something you use, that's fantastic. It will make a real difference for you. But of course, it always feels a bit like a lottery where maybe the medicine you use and currently pay a lot of money for isn't on this year's list. Thanks, folks. We'll look at the next slide. Private health and private health insurance got a bit of interest, which is great. CHF have been talking about this for a long time now and saying not only is the system under pressure, but also the out-of-pocket costs are such that people can't really access it. We regularly hear from people who say, I have private health insurance. I'm too afraid to drop it because I might need it, but I'm also too afraid to use it because I do not know what I'll have to spend. And some of our research last year that showed that 7 out of 10 people got bill shock. That is, they got a bill they weren't expecting. Again, love to know, did that happen to you? Have you used a private system and you discovered a bill came that you didn't know was coming, or that it cost a lot more than you were anticipating? You thought maybe your insurance would pay for it. If you have insurance, turns out it didn't. This is really common. So we're hoping this review will help there. The government separately put some money aside for specialist fees. For years, consumers have been told specialist fees were just a private arrangement between doctors and patients, and that the government couldn't do anything about it. But this budget shifts that conversation. And we know that specialist fees and affordability are a major issue for everyone. So we hope this is indicative of the government actually having an appetite to consult with us, to all of us, and help us solve this problem in the near future. Thank you. And disability has been in the news a lot with the changes to the NDIS. There is money here with a commitment to work with the disability peaks, to support communities through new activities that community groups will run to provide social and community participation. Now, $200 million seems like a lot, but we'll wait to see. The devil's always in the detail. What will it look like when it hits the ground? Thanks, folks. Mental health. If that's something you're interested in, this was a bit of a budget. So there was nothing really new announced, just continuing the things that are already there. My Health Record, it's a lot of money there, you can see. And this should be good, but a lot of this money will go to the technical cost of running My Health Record rather than changes. What is good is there is a little bit more money for this thing they call Share by Default, if you're not familiar with it. The idea is that all of your pathology and radiology results will go quickly into your My Health Record, and so you'll see them sooner rather than later, which is good. More importantly, I think for most of us, it should stop you ever having to have the same test twice. And you can see in the budget papers, the budget thinks that the government thinks it's going to save money this way. Again, love to know, have you ever had a test with one health professional and gone to see the next one and they've said, I don't have your results, you're going to have to do that blood test all over again. You're going to have a new scan. Has that ever happened to you? Because this should stop that. Because when someone says that, you'll say, it's in my health record, clinicians can look it up and go, oh yeah, I can see your blood test results. Great. Save you having a second anything. So we think that's great for all of us, because who wants to have more than one blood test if you don't have to? And we'll obviously save time and money for the system too. Thanks, folks. Then we've got some lowlights too. So one of the things that we notice across the budget is there's a little focus on acute service pressure, but less attention on helping people manage long-term complexity in their lives and healthcare. So service navigation, which is something we believe is really important. This is one of our key asks because we know it helps people manage their healthcare. Didn't really get a mention. Prevention was really limited to screening and vaccinations. Both of those things are very important, but there are other more important things we would think stop you getting sick in the first place, and you can't see a lot of that in the budget. And disability. We would support our colleagues in the disability space in believing there's a lot of uncertainty around how these cuts to the NDIA will impact services and whether the government is indeed taking the right approach here. Thanks, folks. What was really obvious, I did when I was in the budget lockup, one of the things I do is I do a bit of a search of the budget documents, looking for keywords. When you look for words like rural, remote or regional, they're really not there across most of the budget. And so we are concerned that Australians that live in rural, remote and regional areas will miss out because there were no targeted programs about travel and accommodation. Things like urgent care centres require a number of people to be there before they're worth running. And there was the words telehealth didn't appear, virtual care didn't appear. Those things sometimes can be helpful in rural environments too, not only, but certainly there. And there was nothing that talked about the consumer engagement strategy, which I mentioned at the beginning, which we think is really important to ensure that your views are heard. Thanks. We've been listening to our colleagues across the sector, and here are some of their kind of key themes from what they've said. A lot of people describe this budget as a bit of a mixed bag. So ACOS is a good example, who says, you know, the tax reform is good, but then there's nothing for income support or cost of living support. So some good things, some not so good things. In a similar way, we've said highlights, kind of midlights, lowlights, same kind of thing too. The AMA said, great, there's new funding for public hospitals, but there are still other issues, particularly around workforce, that are not yet addressed. So you see, and we can flip to the next slide, you'll see a lot of our stakeholders having this kind of 50-50 view, you know. This again, AAPI says great that mental health of veterans is being recognised, but there's not much else for mental health. COTA, the same, it's great you can now get a shower about time, one would say, but there are no more new packages which are desperately needed. So you see this again and again. We can pop to the next slide, where people say, yes, I can see there are some good things in here, but there are also things that we really wanted to see and are not there. That's definitely occurs across pretty much every stakeholder who's responded to the budget in the public, in the media and so on. I think we've got one more slide too, with the Pharmacy Guild again saying, you know, this is good, and the RACGP. So you can see then they like these measures, but they have concerns about other measures. We see that across. So that's our brief overview of the budget. And now I think Tom's going to join me and we're going to have a bit of a chat about our thoughts about the budget. And there you are. We probably don't need the slides now. Just you and I.
Thank you, Elizabeth. So you were in the lockup and, you know, now we've had a chance to reflect. What stood out to you most from the budget once you probably had time to absorb it and really read through it and think about it and talk to some of your colleagues and talk to consumers?
Yeah, because, you know, it's literally this big, folks, the papers, if you've never seen them before. I take in a tote bag so I can carry them out of Parliament House. So there is a lot in there. And I have been thinking about it a lot in the last few days too. So what stood out to me is that the government is clearly recognising affordability as an issue. We see that in the bulk billing initiatives. I see that and then reducing the co-payment for the PBS from $30 down to $25. We see that in providing free urgent care through those urgent care centres. So that's great. But when you look closely, the investments don't line up exactly with what consumers are saying they need most, especially when it comes to out-of-pocket costs and access. Those things are still not well addressed. Another thing I'd say is that many people are trying to stay well while holding life together. Interacting with the healthcare system actually brings a lot of friction into your life. I don't know. My mum used to call it the merry-go-round. She felt like she was stuck going from place to place to place and it would kind of consume her. And we still seem to assume that everyone has unlimited time, stable internet, and a printer that works.
Right. And where did you see the budget making a real difference for health consumers? And of course, you know, we have to ask the question, where does it fall short?
So, as I think I've said, Tom, I think there's some positive signals, particularly about relating to cost pressures. The government's committed a few $1 million over the next year or so to look at private hospitals, private health insurance, and see how can we reform that to make that work better for all of us. I think that people would welcome that. Again, I'd love your thumbs up or thumbs down. Get your reactions buttons out. Is that a good thing? Do you want to see some reform in that system to make private health, if you need to access it, more affordable, easy to understand, better financial consent? 3 people, the rest of you are happy. It's good to know. 4 people, 5. Okay, very excited. And the specialist stuff too. Again, I'd ask you, out-of-pocket costs for specialists. Who wants to see that addressed? Show me with your thumbs up, your thumbs down, or the webinar chat. Good, more people getting used to those react buttons. Yeah, you like that idea? I think most people like that idea. A few $100s. Some people say it's a few $100s. Well, maybe if you do it once every 5 years and you can afford it, that's okay. But for some folks who have several chronic diseases, have several specialists and seeing several of them every few months, it's thousands of dollars, not just a few hundred. Still maybe falls short on practical support, and I've said that. And consumer engagement is missing. We would want to see also stronger response to the issues around dental and helping people understand Medicare. I was in the taxi today and talking to my taxi driver, and he was explaining that one of his family members had had a lot of illness, and I said, are you registered for the extended Medicare safety net? And he said, what is that? And I explained it, and he said, I've spent thousands of dollars over the last few years trying to support my family member, and I probably hit that safety net, but we as a family never even knew it existed. So that's why that's so important.
Thanks, Elizabeth, and thank you for sharing that consumer perspective as well. So cost of care keeps coming up as a major concern. We know it came through the National Consumer Engagement survey, through our Australia's Health Panel. The cost of care came through. We saw some funding for, specialists in here, but did the budget, move the dial in a meaningful way in this cost of care?
Yeah, it's a good question. And Tess, I can see there that you don't have bulk billing at your general practice. And Britt, I'd agree with you. We'd like to see this National Health Reform Agreement lead to more public access to specialists through outpatients. And also for every Australian to know that when their GP says you need to see a specialist, one of the questions they can ask is, could you refer me to the public hospital, please? A lot of people don't know they can do that and think they have to go to wherever they're told instead of maybe finding a better option. So I don't think in a meaningful way yet. People are still telling us that cost is a big barrier. Things like the urgent care centres and the bulk billing incentives and the new drugs and so on will help some people. There's no doubt about that. CHF did put forward a clear budget submission which was focused on affordability, including this investment in dental and supporting people to use the system. But without that level of targeted investment, it's hard to see a significant shift about what people are paying out of pocket. So we'll continue to make, all of us really, make healthcare decisions with less price transparency than we do when we're buying a toaster. Or I might add, after today's announcement, buying, a loaf of bread from Coles, right?
So, here at CHF, we advocate with health consumers, and, what should the government be prioritising next if they are serious? And, the minister flagged that, these are important things to him about improving access and affordability for consumers.
Yeah. So I'll come back to what I said earlier. First of all, fund the implementation of this National Consumer Engagement Strategy and make sure the department and all these statutory authorities and others use it so consumers are involved in designing and improving the system at every stage. We know that will help. It'll no doubt save money too. Failed implementations, services that are never used. Second, invest in dental care and oral health. That's so important, especially for those who are missing out, and work our way slowly towards universal oral health care, like we do have, in theory at least, with other healthcare. And thirdly, fund that education program. Do you know what the child dental benefit scheme is? Do you know what the pharmaceutical benefit scheme safety net looks like and how to make sure that you get the benefit there? We really need to make sure that people can navigate the system with confidence. At the moment, Australians need a surprisingly advanced working knowledge of Medicare just to use Medicare. And we think these changes would make a real difference.
Thank you to everyone for sharing your reflections in the chat. And I saw a question in there or a statement, Elizabeth, and it says, I don't really know what new investments in health have been made.
Mm.
You know, so yeah, it's a challenging piece of the puzzle there. So yeah, so feel free to ask any of your other questions, and yeah, we can try and address those, and we can yeah, thank you, Elizabeth.
Yeah, thanks, Tom. And Britt, yes, there's not a bulk billing incentive for non-GP specialists that I'm aware of either, but that doesn't mean they can't bulk bill you. So I know people who've talked to the specialist and said, look, I really can't afford it. In some cases, the specialist says, well, that's really not my problem. But other cases, specialists will bulk bill you. Some of them might make an agreement where, how about if I bulk bill you every second or every third, and every other one you pay full price? I think the issue for us is that often not being able to afford care can feel stigmatising. You might feel that you shouldn't need to declare where your income's at and what you need to do. And we think that the specialist should start this conversation with you. The health practitioner should start this conversation with you. You shouldn't have to ask. They should say, how are you okay? Will you be okay to pay for all this, or do we need to talk about it? Again, I can just say in my own family recently, we had to, one of my family members needed to see a specialist. And so I rang up and booked in, and they said, we'll send you out a form. And on the form, 6 different ways they asked, are you going to be able to afford this? Do you have access to any of these services? Do you know you can get a discount for this reason? Are you coming for that reason? Because then we can build this other organisation. I was really impressed. And when we had the first appointment, because I went with one of my children, the doctor asked me, is it okay for you? Can you afford this? Do we need to talk about payment? Now, I could afford the first session. I don't know if I can afford the 10th if we needed them, but I was really impressed that they made an effort to make sure they checked in with me, made it every day, and I didn't feel at all stigmatised in any way or discriminated against, because it felt like this was normal business for this specialist. I'd love to see that happen everywhere. Have an open conversation. Can you afford it? No. If you can't, maybe there's someone they know of they can refer you that would be cheaper or more affordable for you. I think expecting you to have that conversation, or even realising what the cost might be. Like, you might think I can afford 1 appointment, but maybe this doctor knows you're going to need 7. Perhaps they could tell you that on your first appointment and talk about how's this going to go for you, because maybe it's not good for you to stop halfway through, right? Okay. Have we got anyone else wanting to ask any questions in the chat? Feel free to ask some questions if you have any. So the foundational supports, Britt, that's Thriving Kids. So it's just another way to describe Thriving Kids. And the way that the first part of that the government's talked about in the budget is putting in place a 3-year-old check with your GP, assuming you have a GP. So your 3-year-old child will go along and have a check, which will be a longer assessment than normally exists now, and look to see if your child might have some behavioural needs, if they might have some developmental needs, if they might have some mental health needs, and then refer you through to somewhere early on to support them, particularly if the needs they have are mild or low, however you want to describe that. So maybe it is your child needs to have more support with social skills, and that money that has been allocated for states and community services to build programs might be referring them into that program early on when they're 3, before they've started school, for example, to help them with those social skills, provide them with some early other kinds of care as soon as possible. Rather than the current pathway, which is if you're assessed as having a need, you go potentially into their national disability insurance scheme. This new program is meant to ensure that people with I don't know really how to describe them. I mean, people say mild, less, but I think if you've got a family member that needs help, it will never feel mild. So I struggle with that language. But hopefully then that earlier care will really help you. Alan, thanks for your question about remote services. And no, I think this is a real weakness of the budget. And I did say earlier, I did a search, the budget papers for all the words like remote and rural and regional, virtual care, telehealth. Even AI didn't get much of a mention. Normally that gets a mention, right? And did really concern me. I think most of us who've ever had to use the patient and accommodation schemes that each state runs will tell me that those systems don't work particularly well. So getting somewhere is difficult. And then if there's nothing close to home, what do you do? And I think the government said, you know, by the time that all these new services are up and running, 4 out of 5 Australians will be close to an urgent care centre, which on one level I can say that's fantastic, right? But what I worry about, which may be what you worry about too, Alan, is the 1 in 5 that won't be, 20% of the population that won't be close to an urgent care centre. What is the plan for them? And I could not see a plan in this budget for those people. And that is concerning, right? Yeah, that's exactly right, Alan. It's not a small amount of people, but to be honest, I wouldn't care if it was 100 people. People are people, right? Healthcare is a human right. Everyone should be able to access the care they need, regardless of where they live. Sure, maybe we need a different process for someone if they're living in a remote area than someone who's living in an apartment in the Sydney CBD. Okay, I think we can all accept that. I don't think people in the bush are asking for special treatment. They're just asked to get the same treatment everyone else gets, which is being able to access care. And I do think, again, this budget really doesn't focus enough on them. I think there are some groups that you really don't see a strong focus on. And I would say some of the measures that are in there, if they work for you, they will be a boon. But there are many things that haven't really been tackled in this budget, which I'm sure people would like to see tackled. And so that's our job as CHF. Our job is to keep having those conversations, to be that squeaky wheel on your behalf and go back to government and say, this is great, but we need this. And, you know, sometimes I think when public servants or, you know, ministers and so on see us coming, we kind of perhaps duck for cover a little bit, perhaps, because they know we're going to raise those issues. And we understand that budgets are always tricky and there are competing interests. I mean, now it's a good example of where we've got all kinds of things going on around the globe that mean that every minister in the cabinet will be arguing they need more resources to deal with the volatility and the kind of changeability of the globe right now. But of course, our thing's health, and we argue that this needs more attention. 1 in 3 budget dollars goes into Minister Butler's portfolio now, so there is a lot of money in there. What we'd like to see, of course, is people like all of you better guiding the spend, better evaluating the spend, supporting the implementations, because we think we'd make better use of the money if we could do that. Now, there's some links up here for you folks. If you go to budget.gov.au, budget paper 2 is normally where we start. And I can tell you on page 94 is where the health budget starts for a few pages. So if you want to have a look at that, if you like getting into the detail, you'll see every single measure, how much money over several years, and what the intent is. Also, if you go to the Department of Health and Aged Care's Health, Disability and Aged Care's website, you'll see there are budget links on the homepage, and they've got some fact sheets. There's also the text of the minister's speech and so on. So that can give you a bit more details about all of the measures. So if there's something we've said today that you're particularly interested in, you could go there and have a look and see. If you're a member of CHF, so if your organisation is a member of CHF, we're also sending you out an email tomorrow morning with lots more detail and analysis. So for those of you that are here from our member organisations, you'll get that tomorrow. And if you don't know if you're involved with any of our member organisations, you go to our webpage, and perhaps one of the staff would, if you wouldn't mind, one of the team, just popping the link to that page in the chat. You can go and have a look, and you might find, oh, actually, I do stuff with Arthritis Australia. Oh, actually, look, I'm involved with Health Consumers Western Australia. And then you'll know, well, they're getting that briefing from us tomorrow, and I'm sure they'd be very happy to share it with you. So, and we'll put a link to the chat there so you can see whether you are engaged with one of our member organisations. Now, I'm never allowed to forget that we've got webinars on all the time. There are 2 coming up. The first one is next week, is a webinar with our board. We are an organisation which is supported by our members. Thanks, folks, whoever popped that in the chat. And so our members elect our board, which is ensures that we always remain really focused on what our membership need, and our members help us with so many things. We're really grateful to all of you that are involved as members. So if you want to meet our board and see what we're looking for in directors, we have 3 positions this year that will fall vacant. Come along. With all of our webinars, we record them, so if you're not sure if you can make it, register. And if you don't make it, we will send you the link to the recording for you to look at another time. And we've also got a really terrific webinar coming up, which is going to be a great discussion with some consumers and experts about the social and commercial determinants of health. So we often hear about the social determinants of health. What if someone doesn't speak English? We just mentioned, what if someone lives in the bush? There are other reasons too. But there are also the commercial determinants of health. Why is there no hospital here? Why do specialists not visit our area? Why are the fees so high? So we'll be talking about the things that shape healthcare, both from a social perspective and also a commercial perspective. And we'd love you to come along. Even better, bring a friend. And finally, for those of you that perhaps maybe haven't been to one of our events before, there are lots of ways to connect with us. We have a terrific newsletter which goes out today. The links are in the chat there. Subscribe to the newsletter and you'll find out not only what we think about whatever's happening on a given week, but also we do lots of expressions of interest for consumers to get involved with things. There are often different kinds of education and other events on that we advertise, research involvement and so on. So if you're interested in doing more, it's a really good thing to do. We're pretty active on LinkedIn, and we're starting to get a bit more active on Instagram, though I have promised not to take a photo of my lunch. So we'd love to see you follow us in those ways too, and share the love. So I'm just check to see, I don't think we've got any more questions. Tom, I might just ask you too, have I missed any questions?
No more questions in the chat, Elizabeth. So thank you for sharing your wisdom and your insights, and we look forward to seeing more followers and sign up to the newsletters for those that haven't already done so, and engaging in the conversation on social media about the reflections. Lots of conversation in the chat there. So look forward to seeing that carry over to LinkedIn, to Instagram, and to Facebook.
Yeah, and so folks, we always like feedback. I know a couple of people have said thanks. Love your comments in the chat before you leave. What did you like? What didn't you like? Let us know, because we do this again next year. Do you want more of the same or something different? More detailed analysis, a different format? Or was this just exactly what you needed? Let us know, because we're always trying to improve what we do every day. So we'll leave that webinar chat and the webinar open for a couple of minutes, just in case anyone wants to pop in a comment. Otherwise, I hope the rest of your week is terrific. And we're almost at the weekend, folks. For those of you that will be having a weekend, enjoy your weekend. And thanks so much for your time today.